Hi, Dr. Rob. Hello, Dr. Rob.
Hey, Tammy.
I
Hi.
couldn't hear you for a moment, so
I think
hi.
we froze. Good
Yeah, I
evening.
think it's your might be your Wi-Fi. So, okay. So, do you want to say hello and introduce yourself a moment, and then I'll start asking questions?
Sure. My name is Dr. Rob Weiss. I'm a psychotherapist and a sexologist, and written a bunch of books, opened a bunch of treatment centers. My main area of focus has been sex addiction and intimacy disorders in men and women. I've been doing this work about 25 years, and Tammy and I have been doing this group for well over a year. As a company, those of us who work together decided that we wanted to give back some of what we get. And we realized that not everyone has insurance, not everyone has the time to go to therapy, not everyone has the right questions. So we just show up here every week in order to provide you guys with some direction and support. And I would say to that, take what you like and leave the rest. It may apply to the person who's listening or not, or the person who asked the question, don't know. So try to take this in a general way, but we're trying to give everyone an opportunity to get questions answered on a difficult topic: infidelity, sexual issues, relationship issues, and just giving you the straight answers. And by the way, sometimes people will write in and they want a book, or they want information on a treatment program, or they want to connect with a therapist. And I can say that Tammy is amazing at being a facilitator for connections. And so if you write Tammy at seekingintegrity.com, even if it's a really personal thing, you can write confidential. She'll make sure you get directed to the right situation. That's one of the things we're trying to do, is make sure people find healing where they need to. So anyway, welcome and thanks for being here. And Tammy will ask questions and I'll answer them. That's how we do it.
Absolutely. And you're right, we have been doing this for more than a year, because I remember last year, Christmas Eve and New Year's Eve were Monday nights, and you and I were both online with people joining us before the holidays. So it was awesome. So we're glad to be here. Yes, Tammy, T-A-M-I, I'm a four-letter word, and at seekingintegrity.com, or if you go to sexandrelationshiphealing.com, and I'll put that in the chat, but for those of you that are joining perhaps on YouTube, sexandrelationshiphealing.com, all spelled out. There's lots of amazing resources, including a fantastic podcast series that Dr. Rob has created, and Dr. David Fawcett as well. So lots of resources on there that you can find support. So our first question: my sex addict husband has been mad at me from the beginning. This has been about 9 months. We always talk about dealing with the husband who stays, but my husband is still blaming me and wants a divorce. He's in therapy, but he says he is done with me. Is that normal?
So is this someone who's saying that her sex addicted husband doesn't want to be with her and is leaving her, and like is not showing remorse or regret? I don't understand the blaming her part. Can you help me what you think?
Mad at me from the beginning. So yeah, it says we always talk about dealing with a husband, but yeah,
Okay.
he
So
says or she says he's in therapy. But yeah, I don't hear any remorse. I don't hear any, oh my gosh, I've hurt you so much. I don't hear any empathy. So I don't know what kind of therapy he is in or what kind of treatment he's had. So
okay.
this is all
Well,
we know.
I guess what I would say is that couple of things. I mean, men in particular, sometimes somewhat more than women, I think, tend to want to move from one relationship to another. Women may take, or are more likely to take a little time out in between. Men are looking to be in one and then in the next one if they're ready to move and they have issues. So it doesn't surprise me that this man has decided, to take whatever he's been doing all the way to I'm done with you and I'm moving on. And the way to do that without having any bad feelings about leaving you is to say it's her fault. This way he doesn't look at himself. He doesn't have to look at choices. He doesn't have to feel badly or sad or anything about what you shared together, because he's already moved on in his mind and it's your fault. And I think that is a very troubled way for him to try to get to leap from one rock to the other. Unfortunately, you're the rock he's leaping from. You can, of course, be comforted by the fact that he probably isn't going to be healthier in the next relationship than he has been with you, and will regret leaving at some point, but that is moved. I do want to say something else to every partner who's listening. I think it's really important. There is nothing in the world that you can do, no matter who you are, to make someone act out sexually or drink or use, or you can be mad at me, you can withhold sex from me, you can be nagging all the time, complaining, and I could just leave you, or I could just go shopping, or I could take up a sport, or there are many ways I could find myself, find ways to make myself entertained or feel better, or even deal with an unhappy relationship other than going and looking at porn or having sex with strangers or hooking up with affair partners. It's an easier way to sort of frame this is to use alcohol. You know, there is nothing in the world that Tammy is an alcoholic. She talks about that. No offense.
I do. Yeah, you're not sharing secrets.
There is nothing in the world. I know. I can be difficult, and I know a lot. I know her husband. He's really easygoing, but I'm sure he has his bad days. There is nothing in the world that anyone can do to make Tammy drink. She could feel like drinking. She could want to drink. She could want nothing more in the world to drink. But her decision to call a friend and get help, or reach out for support, or go to drink is up to her. Ultimately, between her and her higher power. So there is no way that any of your spouse's sexual or romantic behavior can be blamed on you, except in his mind, because it's much easier to it's an easy way to distance yourself from someone and not have to have feelings about leaving them and all that stuff to say, oh, well, it's their fault anyway. So no, I don't think this, what you're talking about is typical, because I think a lot of sex addicts are wanting to stay in their relationships, and therefore they will at least do the I'm sorry dance. But because your spouse doesn't really have any interest in staying with you, he doesn't really need to be accountable for his behavior, because you guys don't have to work it out, and he gets to skip out of this one scot-free, and it really sucks. The good news is this is an opportunity for you to grow and get a lot of support and work through whatever this is for you. And here we are, and all the groups Tammy's talking about and more. And, you know, I'm not a person who believes in karma, but I do believe if you don't work out your stuff, it's going to follow you. What is the saying, Tammy? Everywhere I go, there I am, or something like that.
Yeah.
So, thoughts, Tammy?
No, I 100% agree. The point of recovery isn't to be angry and blaming. The point of recovery is, like you said, you know, the self-reflection and taking responsibility for my actions and owning what's mine, not taking on other people's, but you know, I definitely have my stuff. And so while I hear he's in therapy, it doesn't sound like he's in recovery. He may have stopped some of the behavior, but it's like the dry drunk we talk about with alcoholics, where they've stopped drinking, but gosh darn it, they're the most miserable people on the planet because they haven't done anything different, and they're still blaming and miserable. So she did add, I think it's a she, still blaming me in disclosure. So you've got a disclosure, so you've got some information, and there is life after this person, and I hope you find healing. If he's filing for divorce, you know, that may be down the pike, and you know, there is life after divorce. So, but I'm sorry, it's painful. Okay, the next question. My boyfriend recently admitted to me he is dealing with an addiction, and I believe is admitting to himself as well. What is the best way to support him at this stage of his journey?
Can you start with that one, Tammy? Because I want you to start that one. I think you have such a lot of experience in this area, working with people and families. And
yeah, I think what you're doing here is awesome, that you're just here and you're learning. You know, I think that's the biggest thing is, and like Dr. Rob just said, you know, I'm responsible for my recovery, but people gave me space and support for that. You know, I didn't get hassled when I was going off to my meetings. I didn't get hassled when I was going off to therapy. They understood that I needed to do that for myself, you know, to a point. I went to a lot of meetings, you know, when I first got into recovery, but, you know, then it changed, you know, then I had enough tools to be able to live life, and now I still go, but, you know, I don't have to be there like every day. And, you know, my entire life doesn't revolve around that. So, but I love that you're here and doing this. There's a ton of resources on the sexandrelationshiphealing.com. There's podcasts that talk about, I mean, just learning about, you know, what sex addiction is and how, you know, somebody with an addiction thinks, which is very different than normal people. You know, it will be super helpful for you. I hope.
yeah, and you didn't say what kind of addiction. So this could be alcoholism or drug addiction or whatever. I wrote a book for spouses and partners called Prodependence. And I would it's Tammy can type the title. It's Pro Dependence, and I type. Sorry, I'm going to
No,
sign
that's
that
okay. I will.
But the reason I wrote this is because I think that many spouses and partners in alcohol addiction, drugs, gambling, there's been a message for a long time that if you're involved with an addict, there's something wrong with you. And if you stayed with an addict, that must mean there's even more things wrong with you. And I just have never really agreed with that point of view. And so I would suggest you read this. I mean, I'll make, by the way, 50 cents a book, maybe 25. So it's not my we don't make a lot of money selling books. I don't recommend my books because I want to make a lot of money, but I will recommend this book because I think that, that there's going to be there's always a lot of messages from around us right now. Or there will be a lot of messages around you that are going to come back and question, what are you doing with this person? Why did you choose this person? What's wrong with you? Or why are you staying with this person? You could, all of those kinds of things. And I think it's important to get a stable sense of a foundation of having made some good decisions. Like maybe you're with this person for a good reason. And maybe there are a lot of really great things about him. And maybe he's really broken in this area and you still want to stay and see him through it. And I would call that person a hero. So I wrote a book in order to be more supportive to people exactly like you, because there are so many negative messages that make you question why love a troubled person. And I say, if there weren't people out there who love troubled people, Tammy and I would be alone all the time.
Correct. Yes.
Sorry, Tammy.
No, it's true. It's true. Thank goodness. So, okay, next, but I agree with you and had neglected to talk about that because you're right. People will go, dump him, get rid of him, you can find somebody else, yeah. So I love that you're here. Learn more. We're here to support you, support the relationship.
I want to say one more thing that occurred to me since you said that, Tammy. Those of you who are being cheated on, who've told friends and family, I just want someone cheated on you and you told your mom, you told your sister, you told your neighbor, whatever it is. Everyone is going to have an opinion about what you should do or not do. And I want you to know that all the people who are having those opinions are right now enjoying their holiday with their husband or spouse, with their family, and they're not in a crisis. Meaning that it's very easy for someone to say, oh, you should leave that person, or you should stay with that person, or whatever somebody's opinion is, but they're not in your situation. They haven't had this ride with that person. They don't share children or a life with that person. And maybe they never loved that person, but you did or do. So I would always take the advice you get from people with a grain of salt, as opposed to using it to turn against yourself, like I should be leaving him, or I should be, you've never chosen him, or I don't think that's helpful. Look for the positive things that made you want to be there in the first place and hang on to that stuff during this difficult time when growth is happening.
And I think it's fair to say, this is what I'm looking for from you, not I don't need advice, or I just need a sounding board. I need support, or, I'd like you to, I'd like to go to coffee while he's going to a meeting or whatever. So I think it's fair to say I'm not looking for you to be, judgmental or tell me what to do. I'm just looking for support. I think those are fair things to do.
And I want to say another thing, Tammy, this is great. Sorry, new partners are really special, I think. This is a time when you're not going to be able to turn to him nor him to you for primary support. You, when you find out more about his addiction, or maybe you already know, are probably going to have some feelings that are going to leave you not trusting or feeling uncomfortable. And you're going to need more support. And he needs to talk to people who are not angry with him, not upset, and who actually have found a path to healing, which is not something you can do directly for him. So one of the problems for all of our couples, no matter whether they've been together 20 years or 20 minutes, is that they struggle with, well, wait a minute, I'm used to turning to this person for my primary support, and now I'm angry at this person, and that person hurt me, and now what do? They robbed me of another thing, if it's the addict who did that. And yes, that's true, and we are all responsible for making sure our needs get met. And so if you're angry at your spouse, they hurt you, they let you down, you don't trust them, you still need the support. And this is the reason, by the way, why we encourage spouses to join groups and stuff. It's not because you're so troubled, it's that you're operating at a deficit. And that's even just in your relationship, you're operating at a deficit because there's not a lot of attention on you. Maybe there wasn't before. So anyway, we really encourage you to stick with each other and get support from each other. And it'll make the healing for the coupleship better, at least in my experience.
I agree. So, okay, this is a long question. I'm having a very hard time sitting through my wife's pain when she's feeling the trauma really badly. We're only about 2 months in, and we've had some very connected moments and intimate moments, but whenever she's really hurting and needs to feel the pain, I bomb out on her and handle it terribly. I make it about my feelings and about how she feels. I make it about how whenever she's I bomb out on her, and I make it about my feelings and about how she feels, or I get stuck in my shame and guilt for making her feel that way. I watched all 3 of Eddie Caparucci's calls on YouTube for August through October, but putting the into practice is what I need. It is so hard, and I'm failing miserably there, handling her triggers when 1 minute things are going great and we're loving and connecting, and then all of a sudden it makes a 180 and back in trauma and pain. She says it never goes away, but she suppresses it at times. How can I learn to handle those moments better? I have read Out of the Doghouse. I'm working through helping her heal. And as I said to Eddie and Tammy's videos, as I've said, Eddie and Tammy's videos that have all been very helpful, but when I need it the most, I default to defensiveness and make it about my feelings. I'm also seeing a therapist, but feel like I'm doing the talking and not getting a lot from him yet. CSAT and highly recommended. Please help. So that was a lot.
Okay. Well, we'll try.
Yes.
So if I had my therapist hat on, I would be doing role plays as a therapist, meaning I would sit and I'd say, I'm going to play your wife and I want you to play you. And I want to see, and why I would be doing that would be to try to get you to figure out the point at which you lose control. Because I'm sure, I guarantee that there's a moment or two, the way she looks at you, what she's saying, where she's coming, and you say, uh-oh, and then you don't stop. Then you start, and I relate to this. Like, I can tell you, like, I'm married. Tammy, I'll tell you my story this morning. I'm doing, we're getting our house painted because the paint is peeling off. And there was some discussion on a walk today about, well, is the person coming at 4 or 4:30? And well, I don't know and I could just tell there was trouble brewing. I'm married 19 years. It was trouble brewing in between us that it didn't matter what we're going to talk about. It wasn't going to go well. And I couldn't help but continue to give my opinion. Never a good idea when you see dark clouds coming. And so it turned into an argument, which is normal for any healthy couple, I think. My point is that it's almost like when we're working with you as an addict, one of the most important things we have to teach you is, when are you triggered into wanting to act out? And what do you do when you get triggered to when you're wanting to act out? Because if, I used to just think, oh, I'm horny, that looks good, I'm going to go for it, right? Then I get into recovery and I'm like, oh, I want to have sex, but maybe that means something else. Maybe it doesn't even matter what it means. I know I'm supposed to do something else, but then have sex with that person, I'm supposed to call someone. And then I'm like, okay, I'm supposed to call someone or go to a meeting, or it's kind of like that. But first, meaning I had to identify the triggers, the little signs that I was headed in the wrong direction, and then do something different, which I learned in recovery. So it's kind of like that. If you, and I know you do, have some awareness of when the beginning of this is happening, whatever this dynamic is between the two of you, what I would suggest is you start talking with her when you're not in this place about a timeout. In other words, say to her, I've noticed when your things are good, I've noticed that sometimes it's hard for me to not react to you. And she's going to say, big surprise. And you're going to say, and I'm really working on that. So this is what I've decided. When I start getting agitated and I want to get like, you don't want me to be and I don't want to be, I'm going to take a timeout. And what a timeout means is that you're going to let me walk away. You're not going to chase me. You're not going to go after me. You're not going to argue with me. And I'm not going to continue the argument down the hall. I'm just going to say, honey, I think I need a timeout. Just like that. Don't even need to say why. And you go and you do whatever you're going to do for the 20 minutes, half an hour, listen to music, go for a walk, Tammy might go for a run, I don't know. And then you have a designated time that you come back and you meet that commitment. I'll be back in an hour. You practice this when things are good, so that when things are bad, she and you both know that when you say, I need a timeout, it's what to do, like a fire drill. I need to do this, that, and the other thing. It isn't going to solve the problem necessarily, but what will solve the problem a lot is you're slowing down, breaking it down into, because the way you describe that is like, she starts like that and then we end up here. I think there's a way that you could probably learn to anticipate that and take some other steps before you end up where you always end up. Just like an addict says, oh, I need to do something else when I'm having this trigger other than go to the bar. So does that help? Tammy, does that help? Do you think? Is that?
Yes, yes, it's interrupting the cycle, because you guys are on a merry-go-round and you're both jumping on, and it's the same spinning thing. And, and until somebody gets off the merry-go-round and goes, there's a different way to do this. And, I really think this is all relationship skills. You're only 2 months in. It is challenging. It takes practice, and all of those uncomfortable things are definitely going to come up. The further you get into recovery, it gets better, and you will be less reactive if you start practicing doing things different. But yeah, I think that you can repeat the same thing over and over again, or you can say, and I love that Dr. Rob talked about, do it when you're not in those moments. You can't be thinking clearly when you start going down the rabbit hole. So you need to be able to do it when you're when things are great. You talk about sometimes we're really connected. That's the time to say, I've really noticed this. I hate it. I don't want to keep doing that. I think there's a better and different way. Let's try this, So I think, but I love that you're here. I love that you're asking. That's versus the person that we just talked about, who is like, I want a divorce, because everything's all that other person's problem.
And I'm glad you're here too. And I want to say this: if you're 2 months in and you've read every one of these books and done all these videos, and I think that what I want to say to you, and you're probably not the only person who does this, is that there is something that contributes to our healing and recovery that has nothing to do with what we read. It has to do with time and patience and absorbing these things and making mistakes and getting it right and relearning. And so, I would just say there's only so much you can expect from yourself in 2 months. If you're not acting out, you're getting support, and you're trying to be a better person, wow, that's an enormous amount. And I would give yourself credit for that. And, some people push themselves so hard in early recovery, they miss the journey, because the journey is about connecting with people and getting support and building relationships. And it's not about how much you read or getting an A. So, it might help to slow down just a little bit. Not that I want you to listen to us any less. But maybe another really lovely evening together, going out or going to a movie or something, and not necessarily watching a video might help. I'm done.
Okay, next one. Oops, it slid. Hi, Tammy, you remember last Monday when David Fawcett was on, I shared that I was going to a singles mixer. I'm a single woman, 1 year sober in SLAA. Well, I took your and David's advice and went in with a positive attitude and with boundaries and took care of myself. I even exchanged numbers with a nice guy and have a date on Friday. Yay! This is my first date in recovery and off dating apps, etc. I feel nervous, understandably. I've been talking to my network, but my question here is, what do you think are the topics that are appropriate for a first date? What shouldn't be off limits so soon? I don't want to overshare. Help.
Well, I do want to say, do you know how old this person is? Because it does matter a little bit, I think.
I don't think we knew age.
Okay.
But female, in
probably
recovery for a year.
Probably under 40.
And yes, not 21. So yeah.
Right, so what do you think, Tam?
I'm so excited. I think this is great. So yeah, no, yeah. I would not share all my personal journey in recovery. Now, that said, my husband, who I adore and have been married to, I did probably everything wrong, because, we went golfing, and then we met through friends. We went golfing, and then he took me to a place that had burritos and beer, and he asked me if I wanted a drink, and I said, no, I'm in recovery, and, so I just kind of shared, because I was like, well, I might as well check him off the list. If he's not going to take that, I don't care. I don't recommend that as the best way to do it. He was kind of like, okay, so, but he stuck around. Good for him. I think there's lots of topics. You have interests. What are your interests? Talk about your interests. Ask him questions. Trust me, guys love to talk about themselves. So just ask him what he likes to do. I think that there's lots of ways to keep it on that, and just see if there's anything. Because then eventually, if you do feel like, gosh, there could be more, and I want to go on this journey, then opening up and revealing, bits and pieces, as time goes by, makes a lot of sense. Thoughts, Dr. Rob?
I think it's a great time this is the best time to be very light and fun about your stuff. Like, if he said something or she said something like, I'm in therapy, what about you? I'd say, oh gosh, I have so many issues, I can't even begin to count them. Like, I would probably just be kind of general, unless that person, because sometimes people want more from you than you really should give. I would not talk about recovery except in the most general ways, unless this person said, hey, I don't drink. Are you in recovery? Well, that's a conversation you could share, but I'm still not sure I would share the details about anything. I think the first dates they're about deciding if you like this person, if you find them attractive, and if you enjoy conversation with them. Really, it isn't much more than that. And so the detail is kind of irrelevant, because you want to see if there's ooh, you're kind of cute, and oh, I like talking to you, and oh, I can't wait to see you next week. Like, that's what you're looking for. And then the rest will follow. And if it's a person who is going to get into you, kind of like, ooh, then you'll probably end up telling them those things at some point. And if they're not, why bother? So, I would say I vote with Tammy. Talk about your interests, things you like, things that are fun, your friendships. Maybe, oh, isn't everyone's childhood dysfunctional? Ha ha ha. I just wouldn't get into it.
Well, and this is practice. So, this is a date. It's a date. It's great because it's kind of a milestone for you, but it's a date, and you'll have more. And it may be with this person. It may be with other people. Awesome. So you can't fail at this. You just get to go practice. Okay. Addition to admitting boyfriend, he expressed wanting to take the relationship to next level, but I have let him know he must take steps towards healing first. Was this a good choice and boundary? Okay, so apparently, I think this is the boyfriend admitted he had a sex addiction or porn addiction problem, and so she's trying to set a boundary about him taking steps to get recovery.
I just am picturing this giant yes across the screen, as big as I can write it. Yes. Like, of course, if someone said, if I was getting involved with someone and they said, well, I have diabetes, and they never say anything about taking care of it, and you say, oh, and they said, oh, that insulin, I'm kind of young, I don't need to really worry about that too much. I would worry. Like, here's this person who has this disease, and it's a disease where if you take care of yourself, you'll be fine. But if you don't, you can get very, very sick. Same thing, so I absolutely would not want to be in a relationship with someone who knew they had an issue, and at least I wouldn't want to be more deeply in a relationship if I didn't know they had a path for healing for it, because then everything becomes about the issue. Lots of drama, lots of problems, no solutions.
Well, and lack of trust. You can't build a relationship with trust when there's somebody is in active addiction, because it's addicts lie, we have problems. So those of us in recovery that get a plan and get tools do really well. And I honestly think we can be more honest than lots of normal people, because we have a program we're working. So I do, I really do.
Well, we're required.
Yes, it's life and death with us. It's not, I'm going to blow that person off and just, say what I want.
But I want to say something about that, why addicts need to tell the truth. And I know we have a lot of questions lined up, but I know we also have, I think, folks from our treatment center here, which means we've got 5, 6, 7 people sitting in a room who've joined us at Seeking Integrity. Welcome. I think it's really important for the person who's telling the truth to understand why we tell the truth in recovery. So I've used this story before often, and some of you may have heard me say it, but I worked with a client who was married. He had 2 children. His wife was in her late 30s. The kids were very young. And she called her husband one day at work, and she said, I got to get away from these kids. I need an hour or 2 to get out of here. She was a stay-at-home mom at that time. And she said, would you come? I want to take a yoga class. And he was like, oh, sure, because I'm going to go. He's thinking to himself, I'm going to go hit my massage parlor. And now I have a legitimate reason to leave work early, because he's an active addict. And so he did that. He stopped off at the massage parlor, told his boss he had to leave early, had his sexual experience, went home, took a shower, cleaned himself up. And when the kids came home, his wife wasn't there. She was out for the evening, and he had a great time with them. He had made dinner for them, and he played with them. And his wife came home. This is a true story. And because the patient, it's what he told me. And he was in the living room playing with the kids, just like she had wanted. And she saw the house was a mess, but she didn't care, because he'd spent the evening with the kids, and she'd gotten to have a night off, and he'd taken care of her and all that. And she came up behind him, and she put her arms around him, and she said, you know what? You are the husband I've always wanted. You are the most caring, giving guy, and look at you playing with our kids and giving me some time, and I'm so grateful to be with you. And, you know, isn't that what we all want? I mean, to be acknowledged and seen by the people we love for the things we give and, you know, all that good stuff. But what he said to himself, I know, because he told me, is with his wife's arms around him and his children in front of him, he said to himself, well, I don't deserve this love that she's giving me, because if she knew what I was doing, she would probably not be here with me, no less be loving toward me, so I don't deserve it. And that's the reason why at the addict end, we really have to keep our side of the street clean, is we're not available to, we are so apt to be self-critical, self-hating. It's so easy for us to fall into patterns of lying and disagreement. And we have to really be quite clear about how we're going to live so that we can feel good about ourselves. Like in that way, it's a little bit of a selfish thing, because if I start hating myself for the way I'm acting in the world, then I don't believe anyone really cares about me. And then the whole thing goes to crap. So I hope that didn't take too long, but I wanted to sort of give you guys a background for why it's so important for those of us in recovery. It's not just for the people we love that we work on ourselves and try to be better people. It's so that we can feel good about ourselves and have room to make mistakes.
Yeah, that person that talked about the shame and guilt, you know, I don't live in shame and guilt anymore. I don't do things, and I have tools. If I do mess up, which I'm human,
You still make mistakes though, right?
I still make lots of mistakes, but
Okay,
but I have the opportunity. I make a whole lot less than I used to, but when I do, I've got tools to use to be able to clean up my side of the street. So, and I'm grateful for that. I don't, you know, I do not spend, you know, months of agony over every little thing. So. Okay, so next question. I am a sex addict in recovery. I am in an AS program. I do a 12-step program. I was an unfaithful male spouse. My wife and I of 37 years both wish to rebuild the marriage. D-Day was about 15 weeks ago. Now we periodically have intimate sex. However, my ED is such that I have difficulty keeping an erection. I'm concerned about satisfying my wife. The question is this appropriate to take goal to maintain an erection, that with understanding to take pills when acting out?
Oh, well, 15 months is not that long a time.
15 weeks.
15 weeks is no time.
Is
Sorry,
no time, exactly.
I heard 15. Okay.
Yeah, no, it says, it's been
So
15 weeks.
You're 4 months into the process. So I don't think that the highest and best use of your focus is to get really great erections so you can rock hard satisfy your wife. I just don't think that's what it's about. If anything, it's about being more nurturing, more emotionally connected, more real, more loving, and a lot less about genital sex. And if you think that your wife's focus in this relationship is your penis, I think you're misguided. So understand, and I'm being kind. We sexualize. This is what we do. We sexualize as sex addicts. We sexualize our relationships. We think if we're not good enough sexually, we won't be wanted, or we rank ourselves, we rate ourselves. Have you asked her? Have you asked her, how are you enjoying our sex life? Have you asked her, if I don't get an erection, how do you feel? Have you told her when you don't get an erection how you feel? I would say before you start running to Viagra or reaching for the doctor, that you actually talk to your spouse about, because you're making things up. I absolutely certain, I mean, I'm going to give it a 90%, that when you say, well, you know, if I'm not like, I don't know what the words were, but if I don't, if I have ED, if I don't get an erection, whatever, who knows what that means? Why don't you go ask your wife what it means to her if you don't get an erection? And why don't you tell her what it means to you if you don't, you know, I think this is more the path. If you don't have sex for a while, I don't think it's that important. Get to know each other better, romantically, intimately, sexually. You are in a rebuilding stage. And I want to say one more thing about this. I don't know your issues. I don't know you. I don't know who you are from Adam. But with many of the people I work with, we are really, the men that I work with, we are really good at having sex when it's about intensity. We can do the mind-blowing, wow, up, you know, but when it comes to intimate sex, it's a real hard, what's the word? Softy. loving, nurturing, caring, intimate sex can be terrifying for us. It's one of the reasons why we race to intensity. It's to avoid intimacy and vice versa. So at 15 weeks, it took me, sorry to say, a number of years before I could really understand the difference between healthy sex and intimate sex and addictive sex and objectifying people and love and nurturing. And I'm still figuring it out. So I think you have a ways to go, and I would definitely dump the Viagra and dump all of those kind of pills, because there's no there. And you don't even know yourself well enough at 15 weeks to know if those erections are not there because there's an intimacy issue or a trauma issue or an emotional issue that blocks you from getting aroused, rather than, I've just got to get a raging heart on. Maybe you don't. So anyway, those are just some random thoughts. I hope you have a good therapist. I hope you have a good couples therapist. These are great questions to be asking, but I think they require expert responses.
I so appreciate what you just shared. And there is no mention of a therapist. I would love to hear what your wife says about your intimate sex, because she may be traumatized every time it happens to her. Like after 37 years, I can only imagine she's reeling, thinking, for 37 years, I'm thinking I've got this, partner with me who's got my back, and he's been unfaithful, and everything's a lie. This is typical. I'm not saying it's you, but this is often the case, that it's very traumatic. And so after 15 weeks to have it be, okay, we're back to sex, and it's, all about performance. I'm with Dr. Rob. So, I hope
go
ahead. I did put the healing
Tammy,
workshop in the chat too.
That's what I was going to say.
Yeah.
I think that whether you come to one of our couples workshops or you go to someplace else, it would be a really good time for you guys to do some communicating, because there's been a lot of changes in a long relationship really quickly. So yeah.
Okay, next question. I am in a same-sex marriage, and my wife was recently disclosed that she has had episodes of sexually acting out only with men over the past 13 years. Should I be concerned that she is actually heterosexual? That's a great question.
Well, I think that's something you have to ask her. And I think that's a kind of a couples therapy issue. And I don't, listen, I don't, does it say, Tammy, how long they've been together? I think it does, right?
Well, it says with men over the past 13 years. So I'm kind of going with they've probably been together for a longer time.
Right. So there are many ways to look at this, and I don't know what they are. I don't think your wife is heterosexual, or she wouldn't have spent 13 years with you in your bed, being with you. Clearly she has feelings for women. But what this is about, it could be many things. It could be that she's a sex addict and she's acting it out as a form of it's just how she acts it out. It could be a trauma-related thing that she acts out with men when she hits some kind of emotional wall. It could be that she wants to cheat, and this is how she wants to cheat. I don't know what it means for her, but I don't think that it means that it is an orientation. There's a lot more going on here than that. I will say this to you, addiction aside, completely aside, nothing to do with addiction, bisexuality is a tough one. Because true bisexual people are really attracted to and can love both genders. And for them, it's really hard, because if they decide to love a woman, they're always going to long for and miss not being with a man. And if they go with a man, they're going to long for and miss. Either way, it's tough for them. However, acting that out without telling you, that would be a big problem. By the way, I don't know, do you guys have an open relationship? Is this okay? I can imagine relationships where your wife might say, occasionally I really want to have sex with a man, and a dildo doesn't do it for me. So, I want to do this. And then you guys would have to talk about, are you going to have an open relationship because she's bisexual and there's something she wants there that she can't get with you. But not if she's a sex addict, not if she's using people as emotionally escaping, history of trauma, and it's causing dysfunction. So these are really complex issues, and I laid out a whole bunch of ways that it could go. By the way, and I would suggest seeing, a professional for sure. But let me say to the rest of the group, everyone else is listening, when I talk, I speak two languages. And I'm sorry. So there's a sex addict language that I speak, which is very sort of like, almost clinical, like I don't use words like dildo, for example, when I'm talking to sex addicts. On the other hand, I wear a sexology hat. And so when I'm talking to people about healthy sex, people who are not sex addicts or people who might be exploring other things, I don't filter my language in the same way as I would for sex addiction. So I just want you guys to understand that I'm sort of coming from two different places at the same time. Some of you might feel like, oh, I don't want to hear that word. I'm in recovery. My apologies, but it directly relates to the question. So I kind of have to do both here.
Understandably. And there are trained sexologists. Dr. Rob and Dr. David are both trained sexologists as well as trained to work in sex addiction. So if you want information and resources on finding qualified professionals for that, email me. Okay, so we just completed our disclosure. It was very sanitized. I knew there wouldn't be details, but this was almost nothing. My husband's relationship with men was summed up as friendships that had gone too far. He said little, even though there were many things he was actually caught doing. He also refused to answer any of my follow-up questions about his behavior. I'm okay,
Oh my.
but I don't even know why he or his therapist bothered. It took us 6 months to get to this point. Thoughts? Well, you're oh my, I'm with you.
I just, first of all, any disclosure that I've been involved with involves, and the person who's doing the disclosure already understands that they're going to be asked questions, and I work with folks to say, you know, this is the range of your answers, so that they don't say really graphic, icky sexual stuff that doesn't need to be said, but at the same time, they're not so minimal as you don't really know what's going on. And the whole point of, part of the point of disclosure is to relieve you of the anxiety of what's been going on. So to hear I was with guys 7 times, but they were friends sort of, and then you don't want to talk, that would make me more worried. So I agree with you. It doesn't sound like this was handled well, and I don't really have an answer for you because I don't know who you work with or what the situation was, but I think it's very fair to say that disclosure didn't meet my needs. And I want to better, and maybe this is what a disclosure would look like. These are things I want to know about. And, you know, and maybe, I don't know if you have someone who's working with you on, you know, sort of on your side of the picture, but maybe Tammy could recommend someone. So, you know, there are people who are also CSATs or other professionals that work with us, our work, who maybe could be a spousal support and guide how you ask questions and negotiate with the therapist, because maybe this therapist is feeling protective of their client, the addict, which we do. But sometimes, I don't know if you notice this, well, you guys don't know this. Sometimes addicts in therapy will say not nice things about you spouses. We will blame you and we will shame you and we'll say how angry you are and how awful you are. And then by the time you actually get to the session for the first time, the therapist probably thinks you're got issues. So, and I mean this, and this isn't because therapists are bad or your partner means it. It's just that this is how they look at the world. They're still seeing you as the problem. And so by the time you get to therapy with them to do a disclosure, they don't know you very well. So that's another piece of it, is I'm not sure I would, anyway, there's so many issues here. Tammy, can you take over?
Well, I don't know if I can take over, but you know, yes, I'm concerned. First of all, I'll back up. Just because somebody's got letters behind their name does not make them an excellent therapist. So there are people I recommend to. There are people I would never recommend to. So training doesn't, you can train a good therapist to be a great therapist. You can't teach a not great therapist to have ethics and things. The other thing I really kind of wonder, because I'm hearing a lot of minimization of his behavior, and it concerns me that the therapist bought in on that as well. There's very there's some protocols that people have taught on how to do a really good disclosure, and it doesn't feel like you guys were either one set up to be successful on that. So I do think it's fair to say, this didn't meet my needs, and we need to go back to the drawing board with a set time. The other thing I'm wondering about is how much he's buying into he really has an issue. It feels like he got caught. And because you said there are some things that he was actually caught doing. So it kind of feels like he's doing the minimal amount, like, okay, I'm going through the motions, but I'm not really doing things. So,
well, and
go ahead.
I'm sorry, Tam, I want to add to that, because the therapist can be, like she said, not everyone with letters after our name. And, I have to do a lot of training to teach therapists how to do this work. And one of the things I have to train them to do that you don't learn when you take a course, you have to be doing the work, is how to talk about sex. And if you have a therapist who hasn't asked your husband, how many times, what did you men do together? Who did what? Where did it go? If he hasn't gone there, then your questions are going to seem really threatening to the therapist too. Like, that's private, because the therapist doesn't feel comfortable dealing with sexual issues. So it could just be that the therapy didn't meet the need. It certainly didn't meet your needs, and you have every right. And I wouldn't do it with rage, by the way. I would do it in, I've been thinking about this. I feel dissatisfied. I want to get my needs, but I want to make this work. And one more thing, I have talked to many spouses who feel badly about how long it takes to get to disclosure. And I understand this. I'm an outpatient. When I was an outpatient therapist, I guaranteed spouses 6 weeks, not 6 weeks to 2 months, but never 6 months. So something is just not right about the whole situation. It doesn't feel good to me at all.
Okay, so next question. This time of the year, I find myself being reflective, but also want to move forward. Have a tough time because thought husband was well on the road to recovery at this time last year and was full of hope. Then he relapsed again in March of 2019, was another traumatic year. Having trouble being hopeful and trustful, even though I know he is working hard. Any ideas on how I can get out of this rut?
Well, yeah, I think it would be useful to accept that we're going to have slips. And it may happen when you don't want it to happen. I mean, you have married an addict. And you have chosen to stay with him or her. And that doesn't mean that doesn't give us a free ride, that you're going to stay with us if we make mistakes and have a slip or relapse. But I think you should expect it. And this is something that I think spouses of alcoholics and drug addicts, they kind of expect that they're going to end up drunk one more time or something like that. But for some reason, the spouses of sex addicts seem to think that we're never going to look at porn again. We're never going to call a prostitute again. And we're never going to be in touch with our affair partner again. And that's just not true. I know that all the men here want to tell every one of their spouses, male or female, I'm never going to do it again. And they mean it. And they mean it in the moment. But I also know that they are going to struggle. So let's have a much more realistic conversation about what recovery is from sex addiction. We're going to slip. We're going to slide. We're going to struggle. And hopefully we're not going to do the worst of it. Maybe we'll masturbate or we'll look at porn or we'll call someone and we don't actually go all the way to being with someone. That would be great. It would be easier on you. But to expect that we're not going to have slips, that we're not going to struggle, I think is unrealistic. So I would say in this new year, what would be my reevaluation of what to expect from the relationship and how to roll with the punches that I don't want to necessarily roll with, but they may show up. And I'm more grateful that my husband's being honest with me than that he has a perfect recovery record. It's just not that kind of a disorder. It's most like eating disorders. And when you have naturally occurring functions like sexuality that someone has to put in a box for safety, it takes a while to get there. And I'm so sorry, spouses, but it's something that, let me say it this way. I ran spouses groups for a while, and I've had spouses say, if he ever does this again, I'm leaving. And I completely understand that feeling, but I don't think I would encourage that because he's going to do it again or something like it. And do you really want to leave? You know, are you looking for the long-term game of the improving, slowly healing relationship in person? Or do you want the quick promise that it'll never happen again, which probably isn't going to be entirely true? I would go for the long process, but that's a whole different relationship. So anyway, that's my response to that, Tammy. I'm sorry this is going on, and maybe this isn't the right message, but it just feels right to me. Tammy, do you have any thoughts?
Well, the Stockdale paradox, I don't know if you recall what that is. I will put it in the chat, but it says you must, so this was one of the prisoners of war. You must never confuse faith that you will prevail in the end, which you can never afford to lose, with the discipline to confront the most brutal facts of your current reality, whatever they may be. Witnessing this philosophy of duality went on, the Collins went on to describe as the Stockdale paradox. And I thought that was always so true. It's like, you have to have hope for the future, but understand in the moment it's not so great or whatever, but I still have this belief that, that we're going to prevail. And so it is challenging to live in that duality. And just a little bit, I think it's real, like I got nothing major going on. And I noticed, and I think part of it's the weather for me, but I noticed I had a bit of the blues the other day. And I was just like, you know what, it's okay. This too will pass. And, you know, it doesn't mean that the whole year was awful, or, you know, I'm starting 2020 off on an awful note. It's just kind of like, go in the moment. You know, I'm not as chirpy and perky as I normally would be, but that's okay. And so I hope, I like Dr. Rob said, I hate that it's happening to you. And, you know, I love that, you know, he did, you know, has been honest, and, you know, hopefully you're seeing more dots connecting, you know, on a recovery path as well. So, okay. Next question. I'm a betrayed partner. 2 weeks ago, in my anger and confusion, I told my husband that I wanted a divorce. Sometimes I want to get a divorce, and sometimes I want to love him and stay with him. A week ago, he told me he wanted to get a divorce. He said that because our relationship has been bad since the beginning. While he was telling me this, I started crying a lot, and he hugged me, and we both started crying a lot. It was weird because even if we weren't talking during our hug, I felt like there was some feeling that I was feeling, which is something I've been needing so much for so long, empathy and compassion from him. Since then, we have had sex almost every day for a week. I've never felt so close and connected with him. After he told me about his addiction to pornography 4 months ago, we had not had sex until this very past week. Is this normal? We've been married 4 years. He has not started therapy, but is coming to the groups here on the website and has been getting better. So,
well,
that's
here's,
a lot.
So I'll just say this. I think the most important thing for me in my recovery in a relationship was trying to avoid drama. I don't want to be screaming and yelling, and I don't want to be honeymooning with someone I just recently didn't trust. My concern for you is what I felt and heard was a relationship that's running more on feelings than facts. We feel really close and it's amazing and we're making love. Oh, we feel distant and I want a divorce. And really those are felt emotional things rather than considered intellectual things. And believe me, when you're in a relationship where someone's cheating and there's drama, you want to lean into the thought part rather than the emotional part. So especially, you know, and that is, so just responding to what you said, you know, I hear the low of, I threatened him with divorce. And then I heard the high of, we're making love every day. And I don't think either one is really true. I don't believe either one. I think your relationship is probably struggling, in a lot of pain, really confusing. And it's easier to run to, we're going to split up, or let's make love and pretend everything's perfect, than be in the middle, which is I'm angry and I'm hurt and I don't have the reassurance that this is going to work, but I'm hanging in there. That's where the growth is. So you asked a question, is this normal? Is this unusual? What was the question? Is this normal? It's very normal. And well, it's very typical, I think, for couples to both be on the roller coaster, not just a partner, but both of them. We love each other, we hate each other, blah, blah, blah. It's normal. I don't think it's the most healing place. I think, and part of it may be, and maybe I'm listening too closely, it sounds like the two of you are turning mostly to each other for information and support. And since you're both very emotional and things aren't grounded, that's going to mean a lot of this. And we really, I think Tammy and I both recommend that each of you find really grounded people who are supportive for yourselves to turn to, so that you can say, I feel like making love with him, I'm not sure, or I feel like telling him I want to leave, I'm not sure. And you have some girlfriend or boyfriend, non-sexual, non-romantic, to hear you out. It will make it a lot easier in those moments to make the right decision in the relationship if you're taking a little time to process your thoughts and ideas with other people. And that's what all of this stuff that we're doing is about. Yeah,
because all I hear is reaction, reaction, reaction. I was angry and confused, so I want a divorce. And then he comes back and he's upset, you know, and then he wants a divorce. And so it's this it feels like a ping pong match going back and forth, you know, and so taking the time, getting the support from outside. And like we talked about at the beginning of the session, getting support that isn't going to tell you what to do and you should just dump them and all of that, but is going to listen and help you, and ideally you guys are getting qualified help, from therapists who know what they're doing that can help you, work through all of this. It's a lot. It's traumatizing. It's no fun, but there's lots of couples that find a healing path through this, and eyes wide open, are on a journey together.
And I want to, just, it's the law of averages. It's kind of the way things are. If you bounced from, we hate each other and we want a divorce, to we can't stop making love, guess what's going to happen next? You're going to be back at the other side.
Yeah.
Because it doesn't sound like there's anything to prevent that. And that would concern me.
Yep. So next one, I've been in recovery for 2 months. I am seeing a therapist, but not a CSAT because the closest one is 200 miles away. I'm attending 12-step meetings, couples counseling, etc. My wife and I have decided to have a period of abstinence since my wife fits my erotic template. I included my wife in my sexual fantasy and watched porn that has women that look like my wife. During my addiction, I would also feel a rush when my wife walked into our bedroom knowing that we were going to have sex. Until I started taking antidepressants recently,
Wow.
I couldn't touch my wife in a non-sexual way without immediately being aroused. How can we introduce sex back into our marriage in a way that does not give me the addictive rush? Is there a recommended amount of time we should abstain from sex?
These are complex questions because most people don't have an addictive rush with their partners. And the fact that you sought out people who were like her or looked like her for similar experiences, and what you would describe as a rush feels a little to me about intensity, dissociation. I feel trauma. That's what I feel. I feel like there's something echoing from the past that's playing out in the present, and I don't know what that is. I mean, I hear therapy issues here is what I'm saying. But in addition to that, I think the way you re-engage your wife, first of all, is by getting to know each other emotionally and intellectually, and then maybe holding hands, and then maybe, giving a back rub, and take the focus, part of your journey would be to be intimate with her without being sexual. No genitals, no, I wear underwear, but we kiss each other, we hold each other. I feel aroused, but I don't do anything about it. It's like, allow yourself to have that place. You won't walk into the bedroom feeling like, oh, that won't happen if you slow your process down. And by the way, if you make it not about sex, but more about touching, if you make a commitment to not having genital sex for a while and work on sensuality and relationship, you'll get a lot further. You might learn some things. What do you enjoy during sex? I mean, just having some conversations about it. I heard a number of people tonight talk about genital sex as being a destination. It's not a destination. It's icing on the cake. There are lots of relationships where people don't have genital sex. They have other kinds of sex. Maybe they can't, or maybe they don't want to, and then the people who have genital sex, maybe they don't have it very often. But what's important is the relationship. And if you are a sex and love addict and you have put a lot of focus on sex when you are acting out, then sex is not the answer in the healing. And for your partners who have been, maybe some of you felt ignored, or no one touched you, no one was with you, he was out somewhere else or she was, the answer is not to now leap into getting all the touch you can get. It's about developing the relationship. And out of that, the sex will come, especially for sex addicts. It may well be, sir, that you find a way to, you call it getting aroused, but I might say you distance yourself from your wife when you walk in the bedroom. You get into this objectified state and you're not really with her. You're in this emotional fantasy like she's porn, So I think there's issues to be worked on there, and they're everything to do with sex, but not about necessarily having it. Let me take a minute. I need to do a little self-promotion here. Just for a minute, guys. I have a podcast. It's no cost. It's called Sex, Love, and Addiction. It's pretty darn good. I've got specialists from all over the world who join me to do talks and engage me, on the subjects that we deal with. We do run a treatment center. It's called Seeking Integrity. It's out here in California. We treat men who have intimacy and sexual issues, porn problems, and we treat co-occurring or paired problems with drugs and sex, whether you drink with sex or do drugs with sex or whatever that is. I'd like to think we're doing pretty extraordinary work at this point in my career. So, but in any case, whether you join us or join someone else, please take time out for yourself to reflect. I think New Year's is a really, I don't know what Tammy does, but I sit down and write. Certainly I do it. This is when I do a gratitude list. And I look for how I can grow in the next year. It's a wonderful time to reflect this week. And I say to all you sex addicts, if you're going to be alone over the holidays, you don't have plans, and you have days ahead where you're not working, please make plans for yourself. This is when we are vulnerable, when we are looking at a couple of days and nobody's around, and, plan the movies, plan a dinner, have people coming over, engage, plan on dropping in on our groups. They're at no cost. But keep yourself, I hate to say this, keep yourself busy, because it's a really good way to keep out of trouble. And especially keep yourself busy with other people, being accountable to other people. You're going to meet someone at dinner. You're going to meet someone after a group or whatever. Knowing that you have to show up will keep you out of trouble. And I want to say lastly to everyone, well, first of all, Tammy, thank you for spending this whole year doing this with me. I really appreciate it.
I enjoy it immensely. And
I really hope that we ultimately give more than we get, but we do get a lot from this too. And I just want you guys to know that. Yeah, so thank you for joining us for this time. We'll be back next week. And and take care of yourself. Oh, I know what I want to say. One more thing. Sorry, Tammy. She's tired of hearing me.
No.
Some of you are having a really hard time, and I've been hearing it in a bunch of emails and texts and all kinds of stuff. And I want to remind you, it's the holidays. We forget. It's like, I don't know why I'm so unhappy right now. Oh, it's the anniversary of my parents' death. I forgot. We forget. Everyone's having a hard time right now, but especially us. Those of us who are looking for love and trust in God. Other than that, those of us who wanted to get through another Christmas without being found out, and it's hard on all of us. And so be gentle with yourself right now. Take time out, relax, spend time with friends, make the holiday something you can reflect well on. And we'll see you in the new year. Yeah?
Yes, absolutely. Thanks, Dr. Rob. Bye everybody.
Guys. Happy New Year.